Ready.
Hi, it's Katie Harris, and this is the Balanced Body Menopause Summit. So, I'm very excited to have you here with us. And today we have Emily Bailey, a nurse practitioner who is talking to us about nutrition and wellness during menopause. Emily, thanks so much for being here with us.
Thank you so much for having me. I really appreciate it.
Yeah, I
So
think
I'm excited.
this is a big topic, and as we all kind of are making our way to menopause,
Absolutely.
yeah, this is really important to understand. So excited to hear what you have to say.
Yeah. And it's a big topic, but it's a big topic now because it hasn't really been something, that's talked about. When we talk about the progression as women, all the different stages that we go through. And it's just something that, isn't really communicated and talked about. So I'm really excited about this summit because now, we can open up the option for people to be able to talk and have this conversation.
Yep, absolutely agree.
Yes. So, well, thank you so much for having me again. And today's topic and what I'll be presenting on is the nutrition and wellness during menopause. So, the first question, what is menopause? And what we're typically told is it's a natural biological process marking the end of our reproductive years. And this is something that typically occurs between ages 45 to 55. And these are primarily the symptoms: hot flashes, mood changes, issues with sleeping, and definitely the weight gain, especially around the middle area. Hormonal changes impact our metabolism, the bone density, and our heart health. But what's really going on? You know what I mean? So let's start back with number one. Menopause is a natural biological process. But what's happening? And what's happening is it's really marking the end of our reproductive years. And there is a huge decrease in some hormones that we've been producing for years. And that's estrogen and that's progesterone. And so, both of those hormones, in addition to how that throws off other hormones and how they're being reproduced. All of those things is what is actually occurring and creating a lot of the symptoms that we're looking at: the hot flashes, the mood change, the sleep problems, and the weight gain. We'll talk about more of those symptoms later. We're told that it typically occurs between ages 45 to 55, but then we talk about perimenopause as well. And I know I really didn't know what perimenopause was until school. And then, actually talking with a obstetrics and gynecologist and, my own doctor. And perimenopause is something that can occur up to 10 years prior to a woman, beginning menopause. And a lot of those same symptoms are, seen during perimenopause as well. Some of those hormonal changes will happen. So, in order to really be considered fully in menopause, you would have to have a cessation of your menses or stop menstruating for a full 12 months. Other than that, um, it's still a perimenopausal state. Additional symptoms, because we talked about like those hot flashes and sleep, and those are just kind of like the standard symptoms that you think about. But one thing again, when I'm saying it's not really talked about as much, when we talk to our primary care doctors or gynecologists or wellness, we don't always hear that all of these are how menopause can affect the body. So two of the biggest things for me is like the brain fog and the depression and anxiety. And to talk to patients of mine and have them describe all of these symptoms, I'm just like, wow, these aren't the general things that were talked about or told about when we discuss menopause. The thinning hair, the dry eyes and mouth. Vaginal dryness that can lead to sexual dysfunction, but the dry skin and the dry nails, the bone loss, the hot flashes. So there's a host of symptoms additional to just the hot flashes and, the dry eyes and sexual dysfunction that can occur. So these are things that just need to be paid attention to as well. Especially if you are perimenopausal or menopausal and you think, oh my gosh, with this brain fog, I'm walking into a room and now I forget why I'm here and, what's going on? Am I starting to have, dementia? A lot of my patients are really, upset and nervous and confused, and they didn't realize that some of these symptoms can actually be as a result of the changes that our bodies is going through. So nutrition, how does that play a part? Why is nutrition so important during menopause? Nutrition, if we really think about it, it's what we're feeding our bodies and what our bodies need to regulate and maintain the natural balance. So balanced nutrition helps manage menopausal symptoms. And menopause may increase risk of heart disease, osteoporosis, and other age-related conditions. And it also will support mental and physical well-being. So let's dig into that a little bit. With the balanced nutrition helping to manage menopause symptoms. And why is that? Well, because menopause may increase the risk of heart disease and osteoporosis. Why is all of this happening? Again, just because of that huge decrease in estrogen that we're seeing, and that is really related to a lot of the lean muscle and all of that being kind of not being able to be supported. We also are looking at the osteoporosis and the bone density. We're looking at increased risk in heart disease. And a lot of this really has to do with the shifts in the hormones that is characteristic of menopause. So, how does this again support our mental and physical well being? When we have the proper nutrition, we can sometimes offset the huge surge of hormones, and it can really help to begin to regulate um, our bodies again. And so the current research right now is showing us that with a low fat, plant based diet, it is really without medications or anything else, you're able to reduce significantly the amount of what we call vasomotor symptoms that you're going to have that occur with menopause. So, with the decrease of all of those symptoms, that in turn also supports mental and physical well being. The key nutrients during menopause. So, I have a few notes on these as well. The calcium and the vitamin D for bone health to prevent osteoporosis, the protein that supports muscle mass, which declines with age. So, that's a big one. We actually need to start increasing our protein during the perimenopausal and the menopausal state. And this is going to support um, us being able to maintain our muscle mass, our lean body mass, which we need to. Our omega-3 fatty acids, we need an increase in those to reduce the inflammation, support the heart health, and the fiber, which will help with digestion, maintains healthy cholesterol levels, and our B vitamins. We really need that, excuse me, which is important for energy metabolism and brain function. Magnesium is a big one as well, but we'll get to that in a few other slides. So, what is suggested and what the research is showing us right now is that a lower fat, vegan, or Mediterranean diet. Um, we'll talk about some of those studies that's been done, but a Mediterranean diet is basically where you have at the very bottom, the most of your plate is going to be those healthy, nutrient dense foods that we talked about. The smaller portion will be fish, and then we have our poultry, eggs, but you have much more smaller portions of the red meat, of the fatty oils and butters. And so, really, is water and a small amount of wine, which is always nice. I mean, who doesn't want wine on the pyramid? The Mediterranean diet as well. I just wanted to show this slide, and this is from one of the research studies done by Silva to show that this low fat Mediterranean type diet really does assist with or how it assists in menopause. And so you'll see with the magnesium, it increases muscle performance, beta carotene, bone formation, all the dietary antioxidants that you're going to find within a Mediterranean diet decreases that oxidative stress and inflammation. So that's just kind of a slide there just to show you how these things battle and combat um, some of the symptoms that we find in menopause. So instead of saying diet and we have to change our diet when we talk about nutrition, I really like to look more for lifestyle changes. I mean, it's really hard, and you have to take into cultural considerations as well. So when we tell people, okay, you have to, eat high protein foods and lower your sodium and do these things, and you're going to feel so much better, drink more water. These are great things that we give to people. and send you out in the world, but it's not really applicable. Like, you don't have a way to really apply this to your life. We have to look at your access to food. We have to look at your lifestyle. Do you travel a lot? If you're not in the kitchen or able to, prepare some foods, culturally, what foods does your family normally eat? So when we look at lifestyle recommendations, we want to include these things, but we want to make those type of considerations as well. And there's always ways to, bring in a lot of these foods that are being recommended. It's just knowing which foods to increase and which foods to have in moderation. Also, hydration is huge. And as I'm saying that, I need a sip of water. And so you want to stay hydrated, manage the hot flashes, regulate body temperature. Herbal teas, water-rich foods like cucumbers, melons, watermelons. It was great this summer, to have those things. But again, cucumbers filled with water, electrolytes, great food. Incorporate into a salad, incorporate it onto a sandwich. There's so many, or a wrap. There's so many different ways that you can stay hydrated through food and also through water as well. On these lifestyle recommended, the one thing I wanted to point out, and I do have underlined, is some of the soy-based foods. And so when you think of soy-based foods, we think of tofu or edamame. And those contain the phytoestrogens, which actually mimic estrogen. And some research that has been done that we'll look at here. It's called the WAVES trial. It was done in 2021, and it was published by the North American Menopause Society in the journal Menopause. And it found that a plant-based diet rich in soy reduces moderate to severe hot flashes by 84%. And that's from nearly 5 per day to fewer than 1 per day. So you can kind of see there the people in the diet group versus the control group. And this was really just a 12-week study. So this was really just, 3 months of, introducing more soy. If you really looked at the trial, it wasn't they only ate that and were, completely didn't have anything else to eat. No, they had a more of a plant-based diet, but they just had soy and they increased their soy. And so increasing that into their diet, it was very interesting to see um, how significantly just that one thing being added to your diet helps with managing those symptoms. So that's, pretty big for me. The foods to reduce or limit, and why I don't say eliminate, again, is everything is in moderation. So it's good to have a glass of wine, a red wine, with the antioxidants in the Mediterranean diet. It's okay sometimes to have some red meat. You just have to minimize the amount in proportion to the other foods, the fish that are high in the omega-3 fatty acids. And you have to look at, increasing some of the soy. And here we are, alcohol. Too much alcohol may exacerbate hot flashes and affect sleep quality. I tell my patients a lot as well, just cutting that out, especially before bedtime, not having a glass of wine before you go to bed, you may see a significant difference as well. So, if you want to have a glass of wine with dinner, maybe earlier in the evening and limit it to, just a glass of wine. Caffeine, it can trigger the anxiety that is, again, normally felt during all these different hormonal changes and disturb sleep patterns. Everybody's different. For me, if I don't have caffeine, that can trigger my anxiety. So I need to have my coffee in the morning or I could be a little anxious. Processed foods. This is really difficult. Most of the meats in our grocery stores are somehow processed, but instead of a deli meat, maybe actually get some chicken breast and take it home and cut it up and meal prep it for the week, and use it how you want to use it after it's cooked, or buy a rotisserie chicken rather than deli meat and slice that. So it's just kind to reduce and limit some things that are processed or excess sugar. The excess sugar, again, the weight gain when you're in perimenopause and menopause, it it does. It changes the level of insulin. There's been studies to look at insulin resistance in menopause, and that may be why it increases the risk of diabetes and the weight gain. But we just know that it can. So minimizing some of that excess sugar and looking at the types of sugar that we eat as well. Instead of a processed white sugar, maybe some honey. To kind of balance. So again, everything in moderation, but just to be conscious. So, lifestyle tips to research these dietary needs and restrictions for, any known diagnosed medical conditions. So, some people who have hypothyroidism or an endocrine disorder or diabetes type 2, and, you're on medications and you have certain dietary needs or you have certain restrictions for medications that you may be on before you adjust or significantly increase and start to consume certain types of foods or take any supplements. You want to research those, and you also want to talk with your primary care doctor. So communication with your primary care doctor is key, but you know that when you go see your family doctor, you usually have only about 15 minutes. And it's not your doctor. I'm a family nurse practitioner. I understand, but it's just the way the healthcare system is. So your primary care provider is usually there to take care of a focused problem or a general assessment. And so, it's tough sometimes to really talk about nutrition and really talk about lifestyle changes. But they do have resources and referrals that they can provide you with. Um, you can also talk to them about your own personal body composition, get a bone mass evaluations. You can look at risk markers for cardiac diseases. So, these are all things once we know, we can communicate with our primary care provider and also work with other providers where, we all kind of work as a group. So, if you want to work with a nutritionist or a consultant, you can do that, and everybody kind of works together to give you that time and that support and the resources for what you specifically need. Additionally, you want to do some weight bearing exercises. Weight bearing exercises are great, again, with the risk of osteoporosis. That increased calcium and the vitamin D with that weight bearing exercise is really going to be key for us to, make sure that we maintain our bones as strong and the muscles supporting them as strong and healthy as we can. Um, as we're talking about supplements, calcium, vitamin D, omega-3s, and magnesium really can support overall health as for women as we age. However, over supplementation is a thing. So again, that's something that you really don't want to just go run and grab from the latest TikTok fad of this is what you need and you have to have this. It's going to make you feel amazing because too much of anything is not okay. And again, you may have medications with supplements that I think they're phenomenal and should be used. You just have to be very, cautious and make sure that your particular conditions or your particular medications will work with and won't have any counter, reactions with any supplements. Also get adequate sleep. 7 to 8 hours is ideal. And that's all I can say is 7 to 8 hours is ideal. And stress management techniques. So meditation, deep breathing between the sleep, the stress, the weight bearing, all of those in addition to the nutrition will really start to help. And you have to adjust this the way that it works for your lifestyle. Just know that with nutrition, it really can single-handedly affect how you feel, and it can help manage some of the symptoms that you're experiencing because of the hormone shift during menopause. So again, the key points here: lifestyle, nutrition changes can really ease those menopause symptoms. And again, when we say exercise, it's not running to the gym or having to sign up for an aquatic fitness class. It's parking a little bit farther in the parking lot and walking across the parking lot to go to whatever store. And you're literally just walking, carrying that bag with you. And, just that right there is a weight bearing exercise, especially if you're carrying bags to and from your car. Instead of having your husband or boyfriend or, whoever help you or get your son to help bring in the bags. Continue to be active every day, continue to use your muscles, continue, to get any type of exercise that you can. The weight bearing exercise and hydration are essential along with nutrition. And so that will be a great, another topic for this summit as well is the exercise during menopause and as we're aging and what really are the best exercises to kind of support us. Um, and within nutrition, I want you to focus on protein, nutrients dense foods, and that will support the bone health, the heart health, and generally an overall well being. Definitely helps with the weight loss if you experience some of that weight gain. So that increased protein need in menopause is key as well. These are some of my references that I used. And this is just a quote that I really like, that aging is out of your control, but how you handle it is in your hands. And I think that's very appropriate. We're all going to age and we're all going to go through this process. And it's how we take control of that. And the more that we're educated and the more that we know, and we'll be more empowered and more educated to be able to ask more questions. And so I hope this was helpful. If you have any questions, I'm sure if you reach out to the Philly Wellness Center, they'll be able to answer any questions or concerns that you may have. I also suggest as well, in addition to your primary care provider, if you want to talk to a nutritionist, some insurance companies, pay for that now. They look at that type of care as, something that needs to be really addressed and support through menopause. You can look at bone density tests. You can work with groups like the Philly Wellness Center and, really focus in specifically for you on how you can handle it and how it will work best for you. All of your lifestyle changes, that you need to make to support you through this process.
Awesome, Emily. Thank you so much.
You're very
This
welcome.
is really great. Yeah. So, I mean, you said so many things. So, one of the quotes that I always like to say is, menopause is mandatory, suffering is optional, and it's kind of like what Diane
Absolutely.
Van Furstenberg is
Hmm.
saying here.
Yes.
Because there are options. And I think that's one of the things. And one of the reasons we're putting on this summit is because women aren't given the options. It's kind of like menopause is just, you had said the end of the reproductive years, but it almost seems
Right.
like the end of your utility, right? Like,
Hmm.
now you're pointless because you've
Absolutely.
gone through menopause.
Right. And it can be construed as that. And I saw this really great documentary on Netflix, and I forget the name, of course, but it was about, they were looking at people who lived to at least 100 years old in all different parts of the world, and what are they doing. And I always remember in one part, I forget where it was, but I believe it was in Italy, and all of the people there lived, it was a very hilly area, kind of like the Manayunk area of Philadelphia. But all of the people there walked every single day. So 80, 90 years old, they were walking up hills. They were carrying their bags. They were walking up steps. They were making their own food. And so they just continued to stay active all the time. They would have a purpose every day to get up. And, the food that they would eat was prepared from them. And so, their cholesterol was lower, their stress was less. And it was just, wow, you really can not have to suffer. You can really live a good life and still be active and, you know, and handle it very well.
Well,
So,
yeah, and that's goes back to one of the other things that you had mentioned, which is about strength training and exercise, because
mhm,
that can't be overemphasized. Like, I mean,
right.
especially at menopause, the amount of muscle mass that you have now is just going to deteriorate. So it's
Increase.
really,
Hmm.
incumbent on you to maintain as much as humanly possible the muscle mass that you have.
Yes.
The only way to do that is through strength training.
Yes. And protein. Eat your protein, and that increased protein need also helps because protein is what helps to develop that muscle. And so you're going to have an increased need from working out, and then you're going to have an increased need because you're going through menopause as well. So you're
Right.
absolutely right. That needed to be
Yeah,
overstressed.
right. Because
Hmm.
if you do nothing from this point on, you can expect to lose 10 to 15% of your muscle mass every decade. That's a lot of muscle mass. And
It's a lot.
yeah, and so that means whatever you're capable of doing now, in 10 years from now, you'll be able to do even less and even less and even less. And we all know, like, what is the one big fear of, your grandma or some little old lady walking around? The biggest fear is that she falls and she doesn't have the muscle strength to break the fall, or, to hold herself
Right.
up. She breaks bones, breaks a hip,
Hmm.
and that is truly the beginning of the end. The frailty of on having
Right.
no muscle mass, it's deadly.
Absolutely. It really is. And without that muscle to support those bones and the fat to support those bones, you're right. It's the beginning of the end at that point. And so you really do have to manage that nutrition, manage that physical exertion. And it's one thing I've always said too. With my son who is now 18, he's gone off to school, and all the bags, like, I'm carrying these bags. I'm like, you know what, this is good. Somebody offered the other day, oh, let me carry those bags for you. I'm like, no, I got it. Like, it's just every opportunity I get, I want to be able to, yes,
Right.
utilize my muscles and continue to strengthen them and make them as strong as possible throughout. So wherever you are in this process, you still have the opportunity right now to continue to make lifestyle changes
Right.
and do
And
those
you,
weight bearing exercises and
yeah, absolutely. And you don't have to
focused
join
nutrition.
an expensive gym. Like that shouldn't be the thing, the
Exactly.
limiting factor. Like you could
Hmm.
just carry bags into the house, and that might be enough because that goes to like another point. Some people will over exercise, like they're like exercising
Right.
themselves into just complete exhaustion. And that's not good either. So there's got to be a happy medium there.
Absolutely. One thing I like to do around the house as well is, even when I have to lift and carry or whatever, instead of just bending over and grabbing a big load of laundry, I just get in perfect form and it's a squat. You know what I mean? And so you can be around the house, and things that you have to lift and carry, if you're in the correct form that you would be at the gym, then yes, you're utilizing your muscles properly, you're supporting your back and your arms. When you're doing that lifting, whether it's around the house and you're doing, you know, carrying your bags in the house for some, you just make sure you have that proper form so you don't injure yourself, and that it's actually being productive
Right.
and helping you retain that muscle mass.
Yeah, and it doesn't take that much. If you strength train 2 to 3 times per week, 20 30 to 30 minutes. I mean, ideally, you'll do it like an hour, but if you even just get 20 to 30 minutes in, I mean, they have
Right.
studies that show it reduces your mortality like significantly, not like 1%,
Yes.
like 15 to 20%. Like all-cause mortality decreases with any, even minimal exercise, just getting up and moving
Right.
around and walking, some strength training. You don't have to work out 8 hours a day. You don't need the expensive
Right.
gym. You just, um, yeah, and you don't need to
Absolutely.
go to like Orange Theory at 5 a.m. every morning. Like
No.
that's not helping. Because
Right.
to your other point, you need sleep, and I think that's underrated as well. People don't
Mhm.
appreciate how powerful sleep is.
Yes. And 7 to 8 hours is what is currently recommended. And, but 8 to 10 is great when you can. It really is. That additional sleep is necessary because your body really has to regenerate and your body has to rest. And it's extremely important. Your mind needs it, your body needs it.
Yeah,
So,
and it certainly gets to be a problem for menopausal women because as you lose your hormones, sleep becomes more and more stressful, right?
difficult.
Because you don't have progesterone, so you can't get to sleep, and you don't have any estrogen, so you can't stay asleep.
Right.
So yeah, I mean, sometimes the best thing you can do if you're not willing or able to take hormone therapy is look at some of the foods because a lot of these foods, as you'd mentioned, Emily, can mimic certain pathways and help reduce some of the symptoms.
Absolutely. And that soy is big. And when I say soy and you think of tofu, the first thing, if you're not vegan or vegetarian, soy sounds like, ugh, like just not appealing. And I have to say, I felt the same way about soy. Uh, Unfortunately, for me, my daughter loves it. And so I had to learn how to prepare it and how to cook it. And once I did, I was like, wow, it's really kind of like a sponge of flavor. And so you can flavor it and, pan saute it. You can, season it and put it in your favorite sauces. It's very versatile. And there's tons of videos to show you very palpable ways of making it. And so just introducing a little moist soy, or the edamame and the beans, introducing that can genuinely help with that hormonal imbalance, and at least help with some of the hot flashes, and reducing that alcohol in the evening as well,
Right. Yeah,
because it's difficult.
I think the Netflix show you probably watched was Blue Zones, or
Yes, it
something
is.
yeah. But
That's
and I
exactly what it was.
Yeah, and I've read books on the blue zones, and they also have a website and an app where
They
you can
do.
Yeah, you
Mhm.
can choose groceries, and actually the app is so like effective. Like you go through and you pick all the things out that you like and that you want to make for breakfast or whatever, and then
Right.
it will put everything that you need in a shopping cart in Amazon, and then they're like, okay, now pay now, and I'm like, whoa, 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 wait a minute.
Why?
Because I had
Right,
taken out all these recipes, and then I had a cart that was like $500. I'm like, no, 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 don't send me this. But
right.
one of the recipes that they did have, and it's going to sound disgusting, but it was this whipped tofu. So basically, you took the tofu and you put it in like a blender, and it was tofu, banana, and like peanut butter. And it whipped up into this like pudding, and it like was the most amazing thing I've ever tasted in my life. Like it didn't
I can
taste,
see
it
that.
doesn't taste like tofu, but it was like a pudding, right? It's not
Right.
kind of goopy because sometimes tofu is just kind of like, oh, well, what is this? But when it's whipped
Right, like
like a
yeah.
pudding, it was just like eating a cloud, like a really tasty cloud. It was so amazing, and that was the best
But I
thing.
can see with I can see with the banana and the chocolate because tofu really is, and I can see if you whipped it, like I said, it's kind of like one of those blank slates. It absorbs its flavor, and
Hmm.
you can make it a little firmer in texture because for some people it's a texture thing. Or you can whip it up, like you said. And I'm thinking like banana and the chocolate. I could see that
I
being
can get into
amazing.
that. Yeah, yeah.
Yeah, like it might actually create the perfect texture for that.
I'm gonna
So
have to look that recipe up again because that was really good.
yes. Yeah, and if you do, you'll have to post that for all of
Yeah,
us.
yeah, I'm gonna add it to your page.
Yes, that would be amazing.
That's too
And
funny.
yeah, I'm so by trial and error, now I would make like this little, almost called it like fried tofu, but I'll just put olive oil like in a pan and season it up with like a steak seasoning. And it got a nice crispy texture. And then I could put it in sauces like a curry sauce and do over rice or naan or add some vegetables to it. And whatever your favorite sauce is, you can add that to it and it really absorbs that flavor. A lot of my family never knew it wasn't chicken curry. It was tofu.
Yeah,
And so yeah, they absolutely loved it. And then I would just take the regular one that I, fried up and throw it into my salad for some protein.
yeah, yeah, no, I love
So
that.
yeah, so
No,
it's
I would say another thing that you had mentioned was, over supplementation. Can you expand a little bit on that?
yes. Again, I always tell patients, I don't want you to go off the latest Tic Tac fad. Because it's, oh, there's these, you have to take this vitamin D and you have to take it with the K and you have to do this and there's this new magnesium and there's this B1s and I'm just like, you can really do more harm than good when you just start hearing different things and saying, oh, okay, well, I need this and I need this and I need this. You need to look at the medications that you have. You need to look at any conditions that you may have, whether they're diagnosed or just symptomatic right now. You need to look at your own personal body makeup and chemistry and your own diet and really see, what you need. You might need iron and you're, over supplementing on B1. You may need to have a body composition done. You may need to have your labs drawn. You may need to have, other diagnostic tests or, a deeper analysis done. A healthy multivitamin is good for women that are aging with maybe an additional calcium. And like I spoke about with the omega-3 fatty acids, a lot of these things you can really just get from your diet. And so the over supplementation can really cause a problem, when it's not being regulated.
Right. And it gets expensive, and the next thing you know, you're taking 20 pills every
Frustrating.
morning. Right.
Yes.
And
Mhm.
one of the things I think with supplementation too is really just, like you said, if you don't know what you're deficient in, you can actually do more harm. And calcium is
Right.
actually a perfect example of that. There's so
Mhm.
much marketing to say take calcium, take calcium, take calcium, but calcium, for strong bones, but calcium is just one of 70 minerals that make up the bones. And if you've ever seen a mineral wheel,
Yeah,
calcium, too much calcium causes, deficiencies and toxicities with other minerals, and then you have those
absolutely.
problems. So it's one of those things that you want to get tested because there's a good chance you don't need half of the supplements that you're
But
taking.
you're right.
And there's also a really good chance that at least one or two of them are doing more harm than good.
Good. Yes. And people need to understand as well that, you have water soluble vitamins and then you have ones that aren't. Those are fat soluble vitamins. And so, oh, if I take too much, I'll just, it'll come. No, not necessarily. And so that's where, you can get a toxicity from taking too many vitamins or, the combination of more vitamins. I had a patient one time who came in with a really strange rash and it was bilateral diffuse and it looked like just extreme some type of allergic reaction, but after a little bit of digging, and she was just kind of bouncing all over the place and she just said I have so much energy. She was taking like this B vitamin that had so much B vitamin that she broke out, and it was an unregulated kind of supplement that they were selling online, and it was a big trend. And this is sure enough where the rash came from a toxic buildup.
Yeah, because more
So
is not
yeah,
always better, but also, like, to the fat soluble, like, and you just have to be careful because,
you
I mean,
do.
if you have digestive issues or if you don't have a gallbladder, your absorption of fat soluble, minerals or vitamins is very, very low, and
Right.
so you could be severely deficient and not even know it. So that, and especially vitamin D. Vitamin D is like, I think we're all deficient in vitamin D for some reason, but I know for my own self, like I don't have a gallbladder, so my vitamin D level is so low, like I have to check my pulse. It's ridiculous.
Right.
So I have to
Hmm.
supplement, and also just take digestive enzymes when I eat because I don't have any. I can't store bile because I don't have a gallbladder, so that's problematic.
Yeah, absolutely. And but a lot of people don't understand that who may have the same issue, but they aren't educated to know that, oh, well, I'm not going to be able to do this. I shouldn't take these types of vitamins or additional supplements. And I do think that you have to talk with your primary care doctor about that, about the
Absolutely.
supplementations, because your primary care doctor is the one who, really looks at all the different medications from any different specialist that you're working with. They kind of bring it all together. So you can understand, what your specific nutritional needs are, what your labs look like, and what the recommendations are. And from there, that's where you can kind of formulate what you need to do for your lifestyle.
Absolutely, because it's
And changes
really
in nutrition.
it has to be customized. There's so much
Yes.
powerful marketing out
Hmm.
there, and we can
It
be
is.
convinced of anything, but you just don't know if those vitamins and minerals are right for you. I mean, they might be right for the indications that they're talking about, but there's probably a good chance that you don't have those indications and you're over supplementing, and that can be very problematic. So,
Absolutely.
all
So,
right. Well,
always get a baseline.
yes,
Always talk to somebody, whether it's, whoever your medical consultant is. Make sure you talk to your primary care doctor, your nutritionist, your practitioners. Talk to them to formulate these individualized plans and make sure they're based specifically for you,
yep,
as you're saying.
absolutely. All right, Emily, this was wonderful. Thank you so much for
It
sharing all
really
this with us
was.
today.
It
Yeah.
was so good to see you. Thank you again for inviting me.
Absolutely. All right. Thank
Okay.
you.